Hello, my name is Fred Trotter. I'm a healthcare data journalist with CareSet. This is the continuing Datapalooza series where we have speakers who spoke at this year's 2024 Datapalooza coming back and saying some of the same things they said. A huge honor to be speaking with Dr. Layden from the CDC. Part of the efforts to kind of modernize the CDC data infrastructure and has a long background in epidemiology, and I believe you are a physician as well, if I'm
Yep.
not mistaken. And I'll let her introduce herself and talk about how she got to Datapalooza. So let me begin with the first question that we're asking everyone: what brings you to Health Datapalooza?
Yeah, thanks, Fred. Great to be here and excited to have this opportunity to continue the dialogue. So, as you mentioned, I work at CDC in public health. I run the data office at CDC. Prior to working there, I worked in public health at the state and local level. So, have had the opportunity to work in different positions in different levels of jurisdictions across public health. And one of the aspects of the work we do is the importance of working hand in hand with our healthcare partners and our healthcare systems. And a challenge we've had for many years and decades, and really was apparent during COVID, was the need for our systems, our data systems and technology to work more seamlessly with healthcare. And so, what really excited me about this opportunity of Datapalooza was to continue that conversation, continue those engagements, and really have public health be a priority aspect or component of this year's Health Datapalooza.
Certainly was. I mean, we were really excited to have the CDC and other health data people, but I think also that's not just Datapalooza recognizing that that's a data priority; it's the whole world recognizing that that now needs to be a priority. One of the things that I do in my job is try to keep myself informed about what data sets there are, and I have been really excited to hear about the wastewater data, but I'll have to admit, wastewater data and data sets like that, I don't know anything about them because they are just too new. What healthcare data sets are you personally interested in and are important for your work specifically?
Yeah, and maybe I'll put in the context of the data sets that are from healthcare that are so vital to the work we do in public health. So public health, whether at the federal level, state level, local level, we have the responsibility to protect our nation by detecting cases of diseases that could be transmitted to others, detecting outbreaks, whether it's an infectious disease outbreak or exposure to something else, and then responding in those outbreaks to shut those outbreaks down so others don't get sick, as well as ensure we inform the public, clinicians, and others about what those health threats are. In order to do our job across the public health ecosystem, it's important that we have certain types of data from healthcare. That includes information and data around cases of notifiable conditions that can lead to exposures or illness in others, or that may signal an outbreak of something, such as a foodborne outbreak that we need to do something about. So that type of information. Laboratory data is really important information in that it helps us to understand if there's an increase in testing for flu, for example, and if among those clinicians that are testing, if the percent positive is going up. And that information helps to inform us of trends in respiratory viruses and diseases, which can help inform clinicians at the front line. Other critical data from healthcare includes vital records data, meaning mortality data, as well as birth records. That helps us to understand disease trends. Immunization data helps us to understand who's at risk for infections or exposures and who's been protected, and allows us to understand the effectiveness of vaccines and other therapeutics. And then lastly is what we call syndromic or emergency room data. Understanding the trends in the types of conditions, the types of presentations that are showing up in our emergency room can often be our first signal of if and what is affecting our communities. So those are the core healthcare data sets that we in public health leverage to detect threats, detect outbreaks, and then respond and shut those outbreaks down.
So for the patients listening, critically important context that Dr. Layden, and it's thrilling to hear this, is she's flipping back and forth between different types of data sources with different provenance. And in general, pre-COVID, all of these data systems were totally separate and totally siloed. And the public health data sets were over here, and the hospital data sets were over there, and the death data set was over here, and none of them necessarily talk together. And so I think part of the modernization effort is putting people like Dr. Layden in the position where they can actually switch between these data sets and talk about them in a holistic way. It's really, really exciting, but that is something that is absolutely vitally in the patient interests. And it's great to hear you able to talk about things in that context. Next question is, in general, what potential recent or upcoming healthcare data policy or technical changes do you care about? Can you give us some insight into what's coming?
Yeah, so specific to the field of the data exchange between healthcare and public health, where there's some great opportunities, is to improve how those systems communicate to each other. So we've seen in the healthcare world where data has become what we call more interoperable. So if you're treated at one facility, but then you want to go on vacation and end up in an emergency room in another place, those clinicians who need vital information about your past medical history or what you might be allergic to can get that information because of that interoperability. We are now at a point where there's some policy opportunities to ensure that the interoperability between healthcare and public health happens. What this will allow is data to flow more seamlessly, more securely, and more complete by having those standards and taking those same approaches that we have to the healthcare systems, having standards around data and technology, and applying that to public health. We can really build up our nation's systems to ensure that those data flow much more efficiently, securely, and at the time that and speed we need it to.
Well said. So, specifically talking about your Datapalooza session, how did you think it went? Is there anything from that session that you would like to specifically chat about? What did you think of Datapalooza overall? I mean, how was this experience for you?
Yeah, well, I would say the overall event was great. It's always wonderful to see people in person, to connect with folks, to hear what they're working on. There was a lot of energy in the room and a lot of public health participation from various levels of public health. I had the opportunity to participate in a essentially like a fireside chat with a someone who works at the front line of public health, so works at the local level, but also has a very long history in working in public health as well as health informatics. And to hear and have a conversation with her about the challenges they face in the front line, the impact of not continuing to fund the public health modernization effort, how it would slow their ability to protect their communities, the tribal nations that they serve, and others. It was good to just have that honest conversations and hear directly from the front line who's benefiting, but also is worried about what the future looks like without additional funding.
So, one of the things that people don't understand about, I think, the CDC generally, probably the biggest thing is that it's the CDCs, right? It's the centers, it's plural. And I think that is the start of a conversation about the fact that there are really tremendous rules. Some of them, born in the Constitution. There's no constitutional right for the federal government to interfere with public health in the states, cities, and counties. And so that means that coordinating and the difference between frontline and local is a lot more complicated than I think people think, which is the reason why I think some of those conversations can be so interesting. This is the point where I open the floor to you. Is there anything that you would like to chat about that we haven't already?
Only maybe a thing to add is that also was apparent at the event was the growing partnership and the need and recognition of the importance and value of those partnerships between public health and healthcare, private partners, vendors who support the electronic health records that clinicians use. These are complex problems that we're trying to solve, and we need to solve it in a way that we have a sustainable path forward. And I think there's broad recognition of and desire across the various partners to work together in the importance of doing that to solve these complex problems. So you're really excited to see that recognition of that and also the commitment to that overarching goal, right? People see the potential that we can really make our systems across the nation much more effective to serve and protect our nation. And there's that common desire to get to that goal, but doing it will take a lot of hard work and a lot of collaboration.
Um, Dr. Layden, I want to thank you for making some time for us. I know that, if you were not here, you'd be working on the infrastructure for all of us. So you making time is extremely generous. I really want to thank you for coming to the interview, but also just generally coming from Datapalooza. And I hope I see you back there soon
Absolutely.
enough.
Absolutely great. Thanks for having me.
All right. Bye-bye.
Bye.